Hi everyone, I'm Dr. Roman, and let's continue with my encouraging case series. Now this is case number 7 of a patient who was given a bad cancer diagnosis, and despite this is doing extremely well. We're always hearing about patients diagnosed with cancer and that they do not do well. Well, I'll tell you what, it's not always the case. Some patients do very well, and this is one of those cases. All right, so let's get started. So this is a case of a patient who presented in her mid-50s with vaginal spotting. In other words, some vaginal bleeding. Now, she was already a few years post-menopausal, and there's no reason why a post-menopausal woman is having vaginal bleeding. So she immediately went to her gynecologist, and they did an endometrial biopsy, and unfortunately was diagnosed with an endometrial cancer. Now, we performed scans of her body, and luckily it turned out that it seemed to be a very early stage endometrial cancer. So the patient underwent surgery, and then once the surgical pathology came back, it confirmed that it did not seem to be very advanced. So it was pretty early stage. She underwent radiation therapy afterwards, and no chemotherapy was given. So at this time, the patient recovered from her surgery, recovered from her local radiation, and was doing very well. Now, 1 year later, she presented to me and we performed scans of her body. And unfortunately, she was found to have a 2-centimeter lung mass. So one isolated 2-centimeter lung mass, which is new. It was not there previously. So when you see something like this in a patient with a recent history of cancer, you have to assume, you know what, maybe this cancer unfortunately came back. Or there's also the possibility that she has a new cancer. I mean, that can also happen. So I discussed it over with the surgical team. The patient underwent a PET scan, and we found out that this 2-centimeter lung mass was extremely intense on PET scan. In other words, it really lit up on a PET scan, and this brings up the possibility of being an actual cancer. So I spoke to the surgeon, and given the fact that nothing else was found in the body, we believed that it was in the best interest of the patient to go for surgery. And that's exactly what we did, because, our training of thought was, it's either a recurrence of her endometrial cancer, or it's a new cancer, most likely lung cancer. So, since nothing else lit up in the body, she underwent surgery. And lo and behold, unfortunately, it was in fact an endometrial cancer. That's right, she was diagnosed with a stage 4 endometrial cancer. Now, we all know that when a patient is diagnosed with stage 4 metastatic cancer, that is not good. So at this time, we decided to provide some chemotherapy for the patient. She underwent carboplatin and paclitaxel-based chemotherapy. And after this, we crossed our fingers. And that is the case. And I just saw the patient, and she's doing very well. And I know what you're thinking. Doc, what's so positive about this? What's so encouraging? Well, I'll tell you why. This happened back in 2011. That's right. The cancer came back in her lungs in 2011. And here we are at the latter part of 2025, and the patient is still cancer-free. I mean, she's already told me that to her, she doesn't even remember the fact she had cancer. And I think that that is amazing, because let's face it, we're constantly hearing about the bad news. We constantly hear that patients with advanced cancer do poorly. Well, here is an exception. And you never know, you may be that exception. And that is the whole reason behind my encouraging case series. So let me know what you think. I'm very happy for her, of course. And, again, I just want to provide some ray of light, the possibility of hope for all of you that are watching this video, because once again, you may be that exception. So all the best to you.